2. Hello, good morning, good evening, good afternoon, depending on the time of day you're listening to this. Thank you so much for tuning back into the podcast show where we are talking about lead poison prevention and just basically sharing information around this topic that still seems to be as relevant as it was back in the 70s, 80s, and beyond in 2021. My name is Karlos Reyes, and I am a community health worker here in the Western Mass area, from Springfield Square One and specifically. And it's a pleasure to be here relaying information and really connecting not only with the people in Western Massachusetts, but around the world, right? Because knowledge is power, as I said in the last episode. And so I am excited because we have a very special guest, and we have Dr. Hilary Branch with us, who is going to be conversing and just sharing information and answering some questions that we have from the medical standpoint. I am not a doctor. I only play one on my other podcast show. So we wanted to get the real professionals on here. So first and foremost, I want to welcome Dr. Hilary Branch. Thank you so much for your time. I really appreciate you for this. First and foremost, how are you today, doctor?
I'm good. It's a beautiful fall day. I'm good.
Yes, it is. The best season in New England. So I guess I'll start this off by asking you this: why are we still concerned about lead poisoning in 2021?
Because unfortunately, it's still a large problem for children, and we have improved over the years of all the precautions we're taking and the testing, but still. Many children have elevated lead levels, and some to the poisoned levels. And why we care is because the major thing we worry about for levels recently are the effects on IQ on children. And so if you look at studies, children who have elevated lead levels, their IQ will drop 4 to 6 points for every increase in 10 in their level. And so we want our children to have the most potential they can have and not be affected by lead. So that's our major concern. We also see, even at low levels of lead levels that are just slightly elevated, we still see some problems with behavior, aggressive behavior, inattention, hyperactivity. So those are the main things we worry about, and that's why we really try to stay on top of it. Occasionally, the lead levels go even higher, in which case then there are medical problems that we see, which thankfully are less common than they used to be. But then you can have trouble with your kidneys, your blood count, growth, hearing, and those are more dangerous levels. Those are more rare, but they still happen. And that's why we care.
Absolutely. Does it still shock you to see, maybe not shock, I guess, but does it surprise you to still see this as an issue in 2021 versus, many, many years ago or what have you? Just a random question that I have for you.
Yeah. Unfortunately, it's not surprising because there's just so much lead still in the environment. Especially, for instance, in New England, we have a lot of older housing stock, and the lead paint, it just doesn't disappear. It is there. Yeah. And so we've taken out lead out of gasoline, and we try to limit what's in water. But there is a lot of old housing stock. It's in the soil. It's still in these homes. And so it's still an issue that's still present in our environment.
Could you explain the levels, so the blood lead levels and what those numbers specifically mean, from a 0 to 10 and 10 for someone who might not understand, and what number, the goal is to get that number back down to 0, but could you explain those levels and what each level means?
Yeah, so less than 5 we consider normal now, not a worrisome level. 5 to 9 really is a level of concern in which we're saying, there must be lead in that environment because they shouldn't be at that level. And so we try to jump right on that. And previously we might have said, oh, don't worry about it. It's less than 10, we're good. But now we try to jump on it in the hopes that we will prevent the children's leads from going higher above 10. So we will check their levels sooner than we would have otherwise. And the effects on those children are usually IQ effects. As mentioned previously, mainly 4 to 6 points from a level from 0 to 10, which is, when you look at IQ, intelligence quotient, it's a test of intelligence, and it won't make you, I try to reassure my patients, it won't make you not be able to go to college. But we want, and you could only figure out with specialized testing. However, we want you to have the most potential. The children have the most potential they can have. So we try to bring it right back down. As you go higher, 10 to 20, it's a similar effect on IQ. Really, the effects on IQ and behavior issues are major concerns up to around the levels of 40. When you get to 40, then we start seeing more medical effects. The level's high enough that it's starting to affect other parts of the body, and much more concerning. And so that's sort of where the step off of really having to be more aggressive with our treatment and trying to bring it down more rapidly.
And so we think about lead as a neurotoxin as well. From Doctor, I've been, on my end, I've met a lot of families who are renovating, remodeling, repainting, what have you, especially during COVID, where we had a little bit more time. Well, some of us had a little bit more time. But with that said, I've also learned that spices can be a factor, and there's so many other alternative sources. Can we talk? I wanted to talk a little bit more about that. And do you see that often as well? I guess the main goal is to be prevented. To be treated for it and what have you. But what are other alternative sources that you've come across in your cases, if any? Oh, is everyone still there? And we might be having some technical issues.
Which are more rare but happen. And such as, imported spices, sometimes will have lead. And they will bring the children's lead levels up some, usually not up very high, but it will elevate the level.
Doctor, I do apologize. My computer screen froze. So as you started to talk, everyone froze, and I didn't get the first part of the answer, which is okay because I can edit that for the show. But if you could please kindly just repeat that, because we missed that.
Right. So there are most of the time, the elevated lead levels that we see are from lead paint. And it's not that kids have to be eating chips. It can be just the dust that's created. They get it on their hands, they get it on their toys, they basically eat the lead that way. That is by far the most common reason we see elevated lead levels. Now, we have found lead in spices. Sometimes you'll come across these, when you have a child whose lead's is elevated. Usually not highly elevated, but elevated. You don't know why, because their house is new and it shouldn't be lead. And then we start asking about these other exposures. Types of makeup is a thing called Kohel that's used sometimes in other parts of the country to prevent evil eyes, like a mascara. And that can have very high amounts of lead. I had a patient who was significantly elevated, actually a pretty high lead level, from using that mascara. And really, we actually checked it. It was so high, they stopped using it, and his lead level came down. So if kids are playing with makeup, things like that. Drinking or eating out of pottery or metal vessels. I had a patient who used a tagine bowl they're from Morocco, and it had a glaze. And so if you have a warm substance that breaks down the glaze or liquid, they ended up eating some lead with their food, and we figured that out, and we stopped that. So there are other ways. We ask about burning lead, anything painted in a fireplace that can give you lead exposure, stained glass work, and any playing with, I know it sounds crazy, but I've had playing with bullets, things like that. Those have lead. So we ask about ceramics. Do they drink out of ceramics, or do ceramics in the home? So we ask some of these other questions, which are less common ways to get it. And we stumble upon some interesting exposures that way.
Sure. And so if I'm a parent and I have a child who is lead poisoned, what are the things that I need to know about testing, and where do I go from there?
Right. So any child in Massachusetts, now each state varies, and the CDC has their own national suggestion, but in Massachusetts, we're the strictest state in the country, and that is because we have the oldest housing stock. So basically every year a child should be screened up to age 3. If they live in an environment, a city or town that has a pretty high incidence of lead poisoning or elevated lead levels, then they should be checked at age 4. If you know that there's a sibling or a playmate that has an elevated lead, or they live in an older home doing renovations, then you should check every 6 months, where you're more aggressive about checking because they're more deemed at risk. I also feel that children with autism should be screened more often if they have pica. It's clear that those children can get, they are some of the highest levels we see, because once they're in a home with lead and they're in their mouth, their levels skyrocket.
Oh, yes. Oh, yes. What can a parent do from the nutritional standpoint to help combat the levels of lead in their child's body?
Well, we recommend certainly iron. You don't want to, if you have low iron, your body absorbs lead 5 times as fast, because lead and iron look the same. So when your body's looking for iron, it gobbles in lead thinking it's iron. So it really absorbs fast. So we try to give them plenty of iron, so the body's not looking to have more receptors out to pull the lead in. High calcium, there's a lot of studies that are show, lower fats, better not skipping meals. There's some subtle things you can do to try to just do the best you can to decrease lead exposure.
Excellent. And so once the levels start going down, I'll ask you this first. If the level gets dangerously high, let's say, for example, 25 to 35. I know you touched upon this a little bit earlier, but if God forbid that level gets high, what kind of dangers are we putting our children in? And can a child still come back from that?
Yes, I mean, around the mid 40s is where we start seeing effects. The kidney effects is called renal tubular acidosis, like a problem with getting the acid out of the blood. We start seeing some effects on hearing, speech, growth, vitamin D effects. So it's more like actually medical concerns that we have at that point. So if they're up that high, usually 45 is our level. We actually use chelators, which are medicines that grab the lead and basically make you pee it out. And so we use those when we need to bring the level down faster. As lead goes higher, up to the 100 range, thankfully, we did have a patient this year who had higher than 100, but in general, that's a rare thing now. But when it goes over 100, then it actually affects the body so much that it causes extra fluid to go in the brain, and you end up with seizures and coma and death in over 100. So There's a whole range of what can happen with lead. There's effects on IQ, effects that it can have.
And, as we're talking about this, I'm thinking about pregnant women. How does this affect pregnant women?
Well, the studies on pregnancy, unfortunately, when you are pregnant, you mobilize lead from the bone. If you have any in your, that you've stored, which is unfortunately because it increases the levels to the child. There are some studies that potentially say you could have maybe a smaller child, maybe a little early if you had elevated lead levels, and also some IQ or development effects. But interestingly, when you look farther out with those children, if there's no more lead exposure and things, they can do quite well. Okay. But we don't want to potentially poison any fetus with lead.
And just in thinking of the times that we live in, this COVID pandemic world, I'm a child who has lead poison, high levels, and then I end up with COVID. Have we seen any connections, correlations, effects, or what have you in relation to COVID in these times with that? I know it's kind of a random question, but it is the world we live in.
Not really with the lead poisoning itself. I think we've all been worried, and I think it's true that there's been more lead exposure because of COVID, because everyone's staying home. And like you said, having extra time to do renovations, and schools are always lead safe, and licensed daycares are lead safe. So these kids are staying in some homes that they would have spent a chunk of time out of, so their exposure is increased. That's the main thing I would say COVID has affected lead.
Okay, wonderful. Well, those are the questions that I have for you. I would love to give you the opportunity to maybe mention anything else that we might have forgotten, or that you feel the world should know, or just people in general around this topic. Any last thoughts or anything you'd like to share?
Yeah, I think it's important that parents know to really screen their children. It's an easy screen. Unfortunately, children who have high lead levels can't tell. They sit there and are happy. There's usually nothing on exam. There's no symptoms at all. So they could sit there and have a lead of 45. You have no idea. They look great.
Yeah.
Concerns. It's not till the lead gets very high do you start having any symptoms. So it's very important. Parents are like, oh my gosh, how can that be? It's like 50 and I had no idea. So get your child screened because there's no way to know otherwise. And then just be careful. If you live in an older home, please don't renovate it or do your own work in the home, because you really increase the exposure to your children and yourselves. So those would just be my suggestions.
Thank you so much. And once again, I always like to throw something frivolous and fun in there. You guys can't see, but Dr. Branch has the coolest purple wall in the background, and it makes me think of Prince, Purple Rain, and I love that. It conjures up good feelings. Doctor, I want to thank you so much for your time. Thank you so much for sharing your wisdom with us. I appreciate you. And again, thank you so much. And to everyone listening, please tune on back. We'll have more episodes with wonderful information and wonderful co-hosts such as Dr. Hilary Branch. Thank you so much. And please, everyone, don't forget National Lead Poison Prevention Week is October 24th through the 30th. So please look out on social media for that. And you can always reach out to me from the community health worker standpoint at kreyes at startatsquareone.org, and I'd be more than happy to share or answer any questions. Once again, Doctor, thank you so much for your time. Thank you to the world. It is our pleasure. Everyone, have a good day or good night.